Now look about anterior dislocation test. Okay, before looking on to anterior dislocation test, this is a classical picture how a patient will appear to us when he has an anterior dislocation. Okay, here there is prominent acromion. Acromion process will be prominent. Shoulder is flattened. Okay, normally the contour will be present as if not exactly a perfect C shape, but some bulge kind of presentation will be there in a normal person. But here it's flattened. Humeral head will become prominent. Arm will be in slight abduction position as well as with elbow flexed. Okay, he'll be supporting the injured hand with the other hand, and then forearm internal rotator and all the stuffs. Okay, now we'll be going with the test for anterior shoulder dislocation. First is Bryan's test. What is Bryan's test means? Okay, anterior axillary. See, you take this image. Here, anterior axillary fold is slightly at a higher level as compared to the injured side. So higher, normal. Okay, higher side is normal, but in dislocated side it will be at a lower level. What is lower? Anterior axillary fold is lower. Lower level of anterior axillary fold. Okay, this is called Bryan's. Okay, Bryan's sign. And then now Dugas test. What is Dugas test means? The patient is made to place the hand on the opposite shoulder. Okay, if this hand has been injured, she has to she or he has to touch the opposite shoulder. Then the examiner will put a pressure on the flexed elbow. Okay, so if he is touching like this, the pressure will be applied here. In a normal person, the flexed elbow will touch his chest, but in case of shoulder dislocation, the elbow cannot touch the chest. Okay, this is what test is Dugas test. Dugas test, whether flexed elbow is touching chest or not. Okay, and then what this another test, Hamilton ruler test. Okay, in a normal person, if we keep a scale or straight rod, okay, the lateral condyle of the humerus and the acromion process, here lies the acromion somewhere, and lateral condyle will be there. These both will never lie in a straight line. Like, I mean, if you keep something straight, they won't come in contact at a straight line. But in case of anterior shoulder dislocation, they lie at a same plane and line. Okay, this is Hamilton ruler test. Okay, and then there's something other called Calvé test. Okay, Callwa, Calvé test. Calvé test, we measure the vertical circumference of the axilla. Okay, this measurement, okay, not the horizontal circumference. Okay, we will be measuring the vertical circumference of the axilla. It is increased vertical circumference on the dislocated side. Increased vertical circumference on dislocated side. Okay, this is management. This is Koch's management, Koch's technique. Okay, here first we are giving a traction. Okay, first I will tell the mnemonic. It's team. Okay, T for traction, we are pulling. Okay, pulling the dislocated hand. Okay, traction. And then external rotation, we are doing external rotation. In the same presentation, without doing any rotation and no other configuration change, we are doing A means adduction. Okay, we are doing adduction, not abduction. Okay, adduction. See, here adduction has been done. M is medial rotation. So traction, this is traction, and this is external rotation, this is adduction, and this is medial rotation. This is Koch's maneuver. There are also some other old techniques for reduction of shoulder dislocation. Okay. Hippocratic method is there. It's kind of brutal. Okay, the doctor keeps his leg foot in between the shoulder and between the in the axilla region, and in Stimson's gravity technique the patient will be asked to lie down in prone position and weight will be attached to his elbow or wrist. Okay, that's all. So the takeaway points are three tests: Hamilton ruler, Calvé, Dugas, and Bryanstein. Okay.